All right, well, welcome everybody. It looks like we have kind of a steady number of people logging on. Welcome to the San Mateo County Growers Forum on COVID-19. My name's Corin Whittle, and I'm the San Mateo County Agricultural Commissioner and Director of Agriculture Weights and Measures Department, and I will be moderating this session today. We put together this information session to help answer your questions as an employer on the recent changes to COVID-19. And we'll be going over the California Department of Public Health's, or CDPH's, isolation and quarantine recommendations, masking requirements, testing, and highlighting some important points on the Emergency Temporary Standards, ETS. As we know, this information is constantly evolving, and the information presented today is current as of today, but will likely change over the next weeks and months to come. So today we have a panel of experts from both San Mateo County Health Department and Cal OSHA to help you to better understand the changes and assist in answering some of your questions. Our panelists from the Health Department are folks that have been working behind the scenes to bring you testing and on-the-farm vaccination. So these are some of the faces, putting faces to the people working to get the vaccinations to your employees. And so first off, we will have Bonnie Holland. She's a nurse and manager over communicable diseases, and she will discuss the isolation and quarantine requirements. And next we will have Dr. Frank Tren. He's the supervising physician and assistant health officer over public health policy and planning, and will speak to testing and masking. And lastly, we will have Zora Ali, senior safety engineer with Cal OSHA Consultation Unit. The consultation unit of Cal OSHA does outreach and compliance assistance for small businesses, and she will be speaking to the ETS and more specifically COVID prevention plans, among other things. We also have Irene Pasma from Healthcare for the Homeless and Farm Worker Health, and she will be monitoring our Zoom chat. Today's session will be 30 minutes of information from our panelists and 30 minutes for questions and answers at the end. We'll have everybody on mute right now, but if you have questions for the panelists, please put them in the Q&A box. So down there at the bottom of your Zoom screen, you'll see a Q&A box and a chat box. So in the Q&A box, you can put your questions, and then in the chat, you can put anything else, but we will be monitoring both today, just in case you put one in the wrong box. And for those of you joining on the phone, at the beginning of the Q&A session, I'll give you instructions on how to unmute yourself to ask a question. So without further ado, let's get started. And first up, we will have Bonnie Holland. Thank you, Bonnie.
Hi, good morning, everyone. I just want to first give you the status of COVID in San Mateo County as we speak. We are headed in the right direction, so that is the positive news, but we still continue to see a significant number of cases. We're averaging about 350 cases per day. And that is down from last week where we were seeing about 500 new cases of COVID identified per day. Hospitalizations have come down. They had been as high as around 145 last week. And now, as of today, they're down to 84 people in our San Mateo County hospitals. 18 of those are in ICU. We've actually in our county unfortunately experienced 27 deaths since the beginning of January. Even though they say Omicron is not as deadly as Delta or one of the other variants, there are people that have, other health conditions that Omicron complicates. And so we did see an increase in deaths. We also are isolating people in our, we have a couple of alternate care site hotels. One's in Redwood City and one is in South San Francisco. And we had a third in San Bruno. But as the cases have been coming down, we were able to close the San Bruno location. And right now we're housing about 45 people, mostly homeless, but also people that can't isolate safely at home because of overcrowded housing and issues like that. And about 93% of our county is vaccinated, which is the good news. And our positivity rate has come down. It was at a high of over 20% and is now down to 10.5% as of today. And we generally run around 1% in good times. And in the more high risk zip codes, it's around 15%. And then to talk about isolation and quarantine, this has become more complicated lately. The CDPH came out with new guidance, and well, CDC did first, about 5 days of isolation and then test on the 5th day. And if you're negative, then for the next 5 days, you can go outside and wear a mask at all times. And if you're a close contact, then if you're not vaccinated, you have to quarantine for 5 days and then test on the 5th day. If you're vaccinated and boosted and you're a close contact, you just have to test on the 5th day, but you don't need to isolate or quarantine. The more complicated issue around isolation and quarantine with farm workers is that they frequently live in a congregate type of setting where they are sharing a bathroom and sharing bedrooms and are unmasked while they're at home. And so that gives transmission a high risk in that setting. And it also, if they can't safely isolate once they test positive, then what I would recommend is that you call the health department, and we're going to give you a phone number and an email address. But the phone number is, I can just tell you, 650-573-2364. And that is our officer of the day. And you just let them know that you have employees that are positive, that they live on site in a congregate setting, and then they'll connect you to my discharge planning team, and they will arrange placement in one of our isolation hotels if the person has tested positive and can't stay living with their coworkers. Also, as far as you having a positive employee on site and you're concerned about the rest of the employees, we do have a team of nurses that can go out, and they have been doing this, complementing the work that Dr. Trin's team does in the mobile clinic, but they will go out and test all the employees to see if there's constitutes an outbreak. And then you would know how to proceed from there as far as separating your negative employees from the positive employees, if it's possible, in the housing that you might have on site. And that's basically it as far as isolation and quarantine. If they do end up coming to the isolation hotel, we generally give longer isolation of up to 10 days. We've been testing people on the 5th day and finding that they're still positive. And there's studies that have shown that they're still infectious after the 8th day. So we don't want to isolate them and then have them go back too soon and still transmit the virus to their coworkers. So it's better once they're in the hotels to isolate for at least 10 days. If they're symptomatic on the 10th day, then they would stay a bit longer. And that's the other difference as far as being able somebody being able to work or not after they are they've tested positive. If they are having symptoms, which are generally like cold symptoms or severe cold symptoms, then they should definitely isolate. If they have no symptoms at all, but they're positive, they can wear a mask, and it's up to the employer to decide if they have no symptoms of illness, if they can be physically distant from the others while they're working. That is up to the employer to decide. And I think that is all I can discuss about that. I think.
Okay, I do see we're getting some questions.
Okay.
But I think we'll hold them till the end and just have them all answer them at one time.
Okay.
So next we have Dr. Frank Tren. Thank you, Frank.
Thanks, Karin. Hello, everyone. So I'm Frank Tren. I'm with Public Health as supervising physician, assistant health officer. I'm also medical director for our county's mobile clinic street and field medicine team. So our field medicine team also has been primarily focused on the South Coast around Pescadero and La Honda, San Gregorio, but doing on-site medical services as well. So some of you may have intersected with the field medicine team as well. So I wanted to talk a little bit about COVID testing and then a little bit about masking, more from the kind of clinical information and background and underlying principles behind it. So when it comes to testing, the first thing is just the different types of tests available. So we, we're 2+ years into this, and everyone knows PCR and antigen, and so the easiest way that I kind of break it down is between PCR and antigen. And then when it comes to antigen, it's antigen testing that's administered by a testing provider, and then the home kits, the home antigen kits. So so first of all, PCR, what PCR testing detects is it detects the RNA of the virus. So the RNA is the DNA equivalent of the virus. And a PCR test is meant to detect the RNA of the virus. And the nature of the test is that it can detect very small amounts of the RNA. And so it's meant to be a very sensitive test that could really pick up any evidence of presence of the virus. And this is whichever site that is being tested. So it's either going to be a nose swab, sometimes an oral swab, but primarily we're using the nose swabs. And so it's the PCR is meant to detect a very small amount of virus in the nose when you're testing that. And so we always say that it's much more sensitive as a test in that it can detect evidence of the virus at a much lower level. The antigen testing, on the other hand, does not detect the RNA. It actually detects evidence of viral particles themselves. And as a test, it is less sensitive. It requires kind of a higher level of viral presence for that test to be positive. And then when you look at antigen testing, but the benefit of kind of comparing the two, the benefit of PCR testing is that it's more sensitive. It can pick up lower levels of virus. The downside to it is that it takes a little longer to get the results. The actual, the sample has to be processed in the lab, and it takes several hours for the actual sample to be processed and for the result. But you have the whole issue around how many samples are going to the lab, and whether the lab, if we're in a high transmission period where a lot of people are getting tested, then you have labs that get sort of taxed as far as how many tests they have to run, and things get backed up a little bit. And so so the downside to PCR testing is that it has to be run in the lab, and it takes some time to get those results back. Antigen testing, on the other hand, is less sensitive because it requires a higher level of virus to be present to get a positive result. But the benefit is that it's run on the spot, and the result comes back quickly, usually in most of the time 15 minutes. And so you have a benefit of getting a result quickly. but the downside is that the test itself isn't as sensitive as the PCR test. Now, for both tests, when you have a positive result, that's usually very reliable. There's not a lot of false positive rates. So where you could have a positive result and that person actually doesn't have COVID. And so the performance of the test, either the antigen test or the PCR test, is very accurate when it's positive. So that's why when you have a positive result, there's no recommendation that you need a confirmatory test for that positive. You will take it as a positive result. But the difference between the two, as far as the difference in sensitivity, is significant. And so when you look at the antigen testing overall, that test will perform best when you have a circumstance where someone may be carrying more virus. And so that's usually going to be someone who's symptomatic, who has and who's in their kind of period where they're carrying the highest amount of virus. And so the accuracy or the sensitivity, the ability for the antigen test to pick up someone who's positive is going to be greatest when they're having symptoms, when they're in a period where they're carrying the most virus. So then when you look at the antigen testing, the other part to kind of break it down is antigen testing that's done at a testing site. If you go to a test site and they are performing the test, versus the take-home test, the over-the-counter test that you can buy in the pharmacy or online and just kind of test on your own at home. And so both of those tests are, the test itself is essentially the same. And the difference is sort of in the technique and method of performing it. You know, how well do you collect the swab? How good of a sample do you get? And then processing the sample the way it's instructed in the instructions. And so when there's any variation in that and the quality of the swab that you get, it can impact the accuracy of the test. And so that's why usually the tests that are performed by someone who's trained to perform it, depending on the kind of guidance around testing, like for example, the Cal OSHA ETS, when they talk about using antigen testing for clearance from quarantine or isolation, that the Cal OSHA ETS guidance is that it's an observed test. So that if you use the antigen test, it should be in an observed setting where it's either performed by someone who's trained to do it, or that there is a video visit or some kind of, or observed by the employer to observe the test result to kind of better ensure that the technique was as ideal as possible. So ultimately, when it comes to the guidance around isolation, quarantine, and testing out, so testing at day 5, as Bonnie had mentioned, to clear someone from isolation or to come out of quarantine. It's interesting that the guidance recommends antigen testing, or that it's antigen testing recommended. And that's because, as I mentioned, with the difference in the sensitivity of the two tests, where we've really gone with testing is, you know, if it were just PCR testing, that's picking up, you know, potentially very small amounts of RNA of the virus. We know that in people that have had COVID, that their PCR test could remain positive for a very long time, sometimes up to 90 days out from their infection. And that PCR test doesn't necessarily mean that that person is still infectious or that they still have active virus. You can pick up the RNA of the virus even when you have non-living, you know, dead virus, non-viable virus. And so that test is quite sensitive. And doesn't necessarily always reflect whether that person is infectious and able to transmit virus or actually carrying continually living virus. So the antigen testing, the thought with the antigen testing is that the antigen testing tends to perform best in this kind of day 2, day 3 of infection through about day 10, in this window period where someone is usually considered to be most infectious. That tends to be where the antigen testing is most accurate or most sensitive. And so the thinking behind the guidance when it comes to antigen preferred for testing out of isolation quarantine is that it's really using antigen testing not as much of a way of just picking up whether someone has COVID or carries virus, but whether they're actively transmissible, actively infectious. And so it's this little bit of a shift in kind of the use of testing that's a little bit subtle, but it's part of what's informed the policy around using antigen preferred to test out of isolation quarantine. Ultimately, it's not perfect. So the performance of the test, even in that setting, is not perfect. So there will be some misses. We will have some people that potentially are still infectious that have a negative antigen test at day 5 and are allowed to come out of isolation quarantine. But that's why the policy is that you continue to mask through day 10 as the further mitigation in the event that that person still is potentially transmissible. And so so that's kind of the best way I can kind of describe the difference between the two tests and how they've been used. One other thing I will mention around testing for someone who's symptomatic. So if you're having symptoms and you want to test to see if you have COVID, in that setting, the most sensitive test is PCR test. But the downside to it is that there may be a delay, there may be a wait in how long it takes to get the results back, depending on how busy or backed up the labs might be. So that's a little bit of a downside. But if that's positive and it has a high sensitivity, has a highest likelihood of detecting whether you have COVID in the setting of being symptomatic. And it can be very good, especially if the interval, let's say if it's a 2-day wait to get the results back, if you're able to isolate at home over those 2 days and just kind of be away from people until you get the results, then it's still an effective way, very effective way to find out if you have COVID. If you use antigen testing, either at home or at a site, in the setting of being symptomatic, then the recommendation is that you test the first day that you're having symptoms. But if that test is negative, that you test on day 3. So 2 days later, so day 0 to 1, and then 2 to 3 days later, you test again if that first test is negative for the antigen test. And that's because, as I mentioned, the antigen test tends to be most accurate when people are having symptoms from this kind of day 2 range to around day 8 to 10 range. And so if you test right at the beginning when you're having symptoms, you may test a little early where the antigen test isn't able to pick it up. And so then if it's negative, you would test, the recommendation is to test again at day 3, because then you would have a higher likelihood of having a positive test in the setting of being symptomatic. And generally, we recommend that if, this is usually in the setting of being sick, having symptoms, that if your first test is negative and you're going to test again on day 3 and you're having symptoms, it's probably best to stay home and not go to work and while you're actively symptomatic, and then to test again on day 3. And that generally gives the maximum performance of the antigen testing when someone's having symptoms. And then another piece when it comes to reporting. So if you're testing at home with a home kit and you have a positive test, should you report it? And the short answer is that you should. You should, as Bonnie mentioned, especially for our community that we're talking about today, as far as farm workers, and especially if people are like your employees and your staff are living in more kind of congregate type of housing, then if they were to test with a home test that's positive, you should call in and check and report that to the public health and the communicable disease team, as Bonnie mentioned, with a home test as well. Now on the kind of the back end, when it comes to officially reported cases, the positive home test cases are not actually officially reported as part of official cases. So that's a little different. That's in how cases are reported. But from a interventional and recommendation and kind of kind of what to do if you have a positive home test. It's the same as if you were to go and get a PCR test or get tested at a site that does antigen testing. You should report it and let us know. So I think those were mostly what I wanted to say around testing. I'll speak a little bit about masking, but I'm also going to, Zora with Kalosha's here, and I think a lot of the kind of requirements for masking and the types of masks required at the workplace, I'm going to really defer to her. But I'll just say a few things just around the kind of some of the clinical components of masking. So when it comes to masking, there's obviously different types of masks. There's cloth masks to surgical masks to higher grade masks, which would fit in the respirator category of like N95s and then in the community you have these other kind of non-respiratory grade masks like KN95s and KF94s, and so really the difference between these different types of masks is the filtration ability of the mask. It's the size of the pore in the mask, and as you move up in grade, the pore size gets smaller and smaller, where you can actually start to filter out more and more actual virus particles. So when you look at cloth masks, what they're really beneficial for is droplets. And so droplets are like mucus and saliva, and you can have virus particles attached to those particles of mucus and saliva. And cloth masks can be effective in kind of reducing droplet. Either if you're coughing or sneezing, it can reduce how much you expel. And then if you're exposed to droplets, the mask can decrease how much you would breathe in of droplets of mucus and saliva with virus attached. When you have free-floating virus, though, that's not attached to mucus or saliva, that's not attached to a droplet, those viral particles are very small and probably much smaller than the pore size in a cloth mask, and probably smaller than the pore size in a surgical mask, which is the next grade up. And so when it comes to aerosol, which when we talk about aerosol, that's free-floating virus, that's free-floating in the air. Cloth masks and surgical masks, the effectiveness to reduce how much you expel free virus or breathe in free virus starts to go down. And so that's when you get to this kind of KN95 mask quality, which is now a non-respirator, because it's not at the workplace setting, but you have a much smaller pore size and much greater filtration ability. And now these masks can actually start to filter out some of the actual free virus particles, both that you would expel and that you would breathe in. The difference between, say, a KN95 that you would buy at the store or online or in the community versus a respirator is usually going to be fit testing. And so when you talk about a respirator, there's also a component of fit testing, which is ensuring that that mask fits perfectly. When you don't have that part and you're using a KN95 or an N95 that you're buying in the community, there's always the part of, does it fit perfectly on your face? And that's where it's a little in question. And so when you have that component to it, that's the difference in, say, performance of a kind of community KN95, N95 mask versus something that you would have at work where you would have a fit testing component, and it becomes more of a respirator grade protection. So then you get to work in full N95s and respirator grade, and then you have this whole kind of process around fit testing along with the quality of the mask, and that kind of maximizes your protection. So given Omicron and the current variant and being more transmissible, there's a lot of aerosol transmission that I think is driving transmission with Omicron. And so that's why there's this sort of guidance around increasing your quality of your mask, is that there's more of transmissions based more on free-floating virus versus droplet than it has maybe in the past. And so it's in increasing the quality of your mask, hopefully you're protecting yourself better from more free-floating virus, in addition to the droplets, which are really important. And so kind of the principles behind the masking, that's kind of the way that to think about the different grades. And so I think that's mostly what I was going to say. I'll probably let Zora mention, if we want to kind of finish the masking piece, I'll probably pass it to Zora for more on that.
Okay.
All right, thank you, Frank. That was great information on the different tests available now. I think it's been confusing for many. And so now we have Zora, and she will speak to the ETS and give us a little bit more information about the mask. Thank you.
Thank you, Corin. Good morning, everyone. Yes, Dr. Trin, thank you very much. In terms of the masks, yes, there is a requirement actually in the standard. Hopefully you're all aware of the emergency standard. It's been in effect since November of 2020. It's changed and changed again. So we've had a new readoption as of January. So that I just wanted to mention really quickly before I forget, we have actually been doing a few webinars on the changes to the emergency temporary standard. Our last one is tomorrow from 1 to 3 p.m. I actually sent Corin the link. If you want to register, it's free. I'm actually one of the presenters along with two of my colleagues, and we talk about all the changes that you should be aware of. And we talk about how this whole process happened. It's been like, and we do answer some questions live as well. So you might want to stay for that or sign up for that, hopefully. The first thing you should, in terms of the masks, I'll jump to the masks first. In the standard, they talk about providing a respirator. So a respirator can be voluntary or required. Now, Dr. Trin was talking about wearing it without being fit tested, and that would be voluntary use. You're not fit tested, you're not medically evaluated, but you do have to provide Appendix D. I think, Corin, you mentioned something about some kind of an R, I think it was an R paper. I don't know if that's the same thing, but I sent you the link to Appendix D as well. So that's what you want to give to the employees that are wearing it voluntarily. And we do, based on the governor's executive order, we're following the quarantine and isolation guidance. And Corin, I think you have the table for that too, that I think my supervisor sent you. We're actually going to go through that in detail at the webinar tomorrow as well, because we know it's really confusing. I know Dr. Trin talked about it as well in terms of isolation, how long you have to isolate when you can come back to work. So the CDPH's guidance overrides our standard because of the governor's executive order. And we're aware this is going to change next week in terms of masking. So I don't know how that's going to work with CDPH. We'll find out. But right now in our standard, if you're fully vaccinated, you do not have to wear a mask indoors. But like I said, everybody has to wear one right now. And in terms of wearing one voluntarily at work, even if someone's fully vaccinated, if they want to wear one, you have to provide it for them. So just make sure that you have a supply of N95s. So if somebody feels like they want to wear one, they can. KN95s are considered basically a mask. They're not recognized as a respirator because they're not NIOSH certified. Now, and if you require a mask, so you're telling employees you must wear a mask, you have to medically evaluate them, you have to fit test them, you have to have a respiratory program in place. So think about what you want employees to do. There are some cases where they are required in certain industries based on what they're doing. But in this case, voluntary use does not require that, just Appendix D. And Appendix D just says you have to store them properly, follow manufacturer's instructions on how to wear them. It's usually on the box, and there's something in there that talks about how to put them on correctly. We actually have a video on our website too on how to put a N95 on correctly. So you can look there too. So that's the thing about masks. And it's really important to note the difference between voluntary and required use. And in most cases for the emergency temporary standard, it's going to be voluntary use. So just Appendix D, make sure people understand how they're supposed to use them and give them the instructions. Now, the other thing that you should be doing is update, and hopefully you know about this too, you should be having a COVID prevention plan at the workplace. That was required as of November 2020 as well. And I sent Corin the link as well. It's a fillable plan. You just take a look at it and tailor it to your workplace. It's actually been updated as of since the standard's been updated. So take a look at that. The other thing I wanted to mention was that we do have a lot of FAQs on our website regarding the ETS. And we actually have guidance for industries on COVID, including agriculture. So you might want to look at that, because that you might find really helpful for you, for your industry, since it's very specific in terms of what you do and you know, people being outside. And we're talking a little bit about housing and transportation in groups, so that we see a lot in agriculture. I've done a lot of agricultural inspections. I used to be in enforcement, and I saw that all the time. And so take a look at that, because a lot of the FAQs are actually from employers. So you might find answers there. There's all kinds of FAQs as well in terms of COVID reporting requirements. When do you report it to us? When do you have to report it to Cal OSHA? When do you have to report it? When do you have to notify the public health department? And that's usually just only during outbreaks. So if you have an outbreak, which is 3 or more employees within 14 days, according to the temporary standard, 3 or more employees within 14 days in the exposed group. So take the standard explains what an exposed group is, or 14 or more, or 20 or more employees within 30 days. That's considered a major outbreak. And so you have to report those to the public health department, but not to Cal OSHA. Cal OSHA does not need to be, you don't report an outbreak to us. So definitely take a look at the webinars. And in terms of Cal OSHA consultation, I know people see Cal OSHA. I was talking to Corin about this, and people see Cal OSHA and they don't want to talk to us. And I totally understand that, because we have enforcement, and I used to work in enforcement, so I understand. But we are actually, I am with consultation now. So we are totally collaborate with employers. You can call any of our offices if you have questions, if there's something that's not clear. We actually go to your site if you want us to. We just ask that you correct things that we find. If there's any things that need to be corrected, that you correct them. We'll go over your programs, anything you want us to do. And we do not talk to enforcement. Enforcement does not know where we are or what we're doing. It's considered confidential. Even though we are all Cal OSHA, we still have our own units. You will never find an enforcement office and consultation office in the same like office space, because we keep everything separate. So please use us. If you call our offices, we have 7 throughout the state. And I know a lot of people have been telling us at some of our webinars, well, we keep getting voicemails, and that's because a lot of our employees are teleworking because of what's going on. But we do, including our clerical staff. So they check the phone lines regularly. So if you leave a message, it will go to whoever the duty person is, and they will call you back. So please don't let that discourage you from calling us. And I don't know if I have time, Corin, you had a couple of questions here that you sent me. Do you want me to go over a couple of these?
I think that'd be helpful. We only have a few questions in the chat at the moment, so I think we have time.
Okay, so one of the questions was, can you ask about everyone's vaccination status? Yes, if you look at the Fair Housing and Employment Department website, in their Q&As, they actually say you do have a right to ask for vaccination status. Now, in our emergency temporary standard, if you look at the definition of fully vaccinated, it describes, you have to have the 2 shots and series approved shots by the FDA. But also in terms of, in the definition, it says documented by the employer. And if you look at our FAQs, documentation can be that you have proof of the vaccination status, you can see the card, self-attestation, so an employee just tells you they're vaccinated. Now, if an employee does not want to tell you they're vaccinated or doesn't want to give it to you, you have to treat them as if they're unvaccinated. So if someone says, well, I don't want to tell you, they have to wear a mask indoors now. And that's just a reality. Now, some employers, we do find they're just requiring everybody to wear a mask, regardless of the standard. And that's fine too. If you want to do something above our standard that's more stringent, you can do that. Again, with the CDPH, they're asking for 10 days. And actually our standard says 14, but like I said, CDPH is overriding us right now with the governor's order. And if some employers have actually told us, well, we're telling them 14. And we said, that's totally fine. If you want to do 14, you can, but you have to do minimum of what's required. You can't do less than what we ask. So yes, you can ask, but like I said, if they don't tell you, you assume they're not vaccinated, and then just move forward that way. There's another question on congregate housing on your property. What is your responsibility? So if there is a section in our standard on housing, and we'll cover that in the webinar tomorrow as well, by the way. If all of the people in the housing unit are fully vaccinated, certain sections do not apply anymore. So some of those sections, let's see, some of the sections would be like disinfection and cleaning. And but the thing that does not change is testing. So if you do have a positive case, you still have to do the testing and whatever else is required by CDPH. Now, I think, Corin, you were asking me about contact tracing. I don't want to forget that. We don't actually have anything specific in the standard that says contact tracing, but if you have the COVID prevention plan, you do have to have an investigation procedure in place. So if there's a positive case at work, and like I said, don't forget, this is only work related, the standard. So if you have a case that's positive at work, you have to follow this, you have to have an investigation process in place. So that would be, for instance, finding out who was a close contact within the exposed group, which is defined during the infectious period, which I know the doctor was just talking about. And in that case, you have to notify the people in the exposed group that might have had a contact within 1 business day. It's actually very specific within 1 business day that they might have been exposed to someone with COVID. And that's the closest we get to contact tracing. But also in that notification, you cannot give any personal identifying information. So you can't give them the name or anything that would identify who it is. Now, some people say, well, what if they guess? Well, you can't stop people from guessing or figuring out, or somebody tells them on their own. You can't stop that either. But in terms of an employer, you want to keep the confidentiality. So that's pretty much the closest we are to that in terms of contact tracing. But you do have to notify everybody and let them know they might have been exposed to somebody. Do I need to require that my staff wear masks? Well, right now, per the state, yes. Everybody has to wear masks. Even within Cal OSHA, we are not allowed in the office without a mask. We have to wear it. And that's basically the entire state right now. Now, as of next week, I know that changes on the 15th. So if we go back to our standard says if you're fully vaccinated, you do not have to wear a mask indoors. But if you are not vaccinated, you still do. So that will be the difference next week. Let's see. If you have an outbreak, is that a workers' comp issue? That I get, it's only a workers' comp issue. I would think if anybody has to, is sick or has to isolate, I think I would refer back to your workers' comp carrier on that, because in terms of dealing with, I've done a lot of accident investigations as part of enforcement. And sometimes what Cal OSHA will say is an illness or an injury, workers' comp might not. So I would just talk to your workers' comp carrier to see how they would deal with an outbreak. But in terms of an outbreak, you just report that to the public health department, not Cal OSHA. And like I said, if you look at our FAQs, there's a lot of Q&As on there and what has to be reported. So of course, a death from COVID that is work-related has to be reported. Any hospitalization has to be reported to Cal OSHA if it's COVID. I mean, like I said, these are all work related. So if somebody got COVID when they were on vacation and they didn't expose any employees, that's not Cal OSHA. We're only looking at workplace exposures. Am I mandated to provide sick leave? I don't know that one. That one I'm not sure. I would talk to the workers' comp carrier on that, or possibly DLSE, which is the Department of Labor Standards and Enforcement. That is our sister agency, and they deal with wage issues and retaliation and discrimination issues, things like that. But most employers do have sick leave. So I don't know if you're asked if that question has to do with sick leave, if someone is sick with COVID or not, but definitely labor commissioner might be able to answer that one better than me. Let's see. I think some of these questions the doctor answered actually.
Yeah, I think that probably covers covers a lot of it. And so we could get to our Q&A portion. We only have a few questions in there, and we'll see if any more pop up.
Okay.
And thank you so much for all that information. I did put a lot of links in the chat that Zora was talking about. One of them specifically, the webinar tomorrow, Cal OSHA Consultation does these free webinars, and they're very informative. I've sat in one myself just to get this information on COVID, as it's always changing. And then she mentioned the labor commissioner, that has to do with wages. And so hopefully if there's any questions about sick leave, those answers can be found there. So we'll start with the Q&A session now. And so if we have anyone joining on the phone, which I don't think we do, but if you want to unmute yourself and ask a question, it'd be *6 to unmute yourself. But I'll start here in the question. So can a vaccinated person transmit the virus the same as an unvaccinated person? And I would maybe Dr. Tren, you could handle that one.
Sure. Yeah. The data seems to indicate that probably less so if you're vaccinated as far as transmission. The real world data, it's unclear as far as the real world data for that. But from a kind of concept standpoint, it seems that people who are vaccinated might carry less virus in their upper airway compared to someone who's unvaccinated. And so kind of conceivably, potentially would shed less virus. But real world data, I don't have real world data to pull from to answer that, but conceptually, most likely.
Okay, and then we have a question. Looks like were two sort of similar for Bonnie. One is there transportation available to transport people to the isolation hotel? And the other one is, how can participants request the taxi service through 211? Question mark. Bonnie, you're on mute if you're talking.
Yes, we do have taxi service that will take clients that need isolation from wherever they are to the isolation hotel. And preferably it would be as early in the day as possible because the hotels, there is a cutoff time of 4 p.m. that people need to be there by. And that's for a number of reasons. And the second part of that question was, how do you request it? It would just be part of the placement service. You don't have to call 211 for that. You can call 211 to request isolation hotel placement. And then as part of that, the team would order the taxi for the person that was accepted into the hotel.
All right, I think that answers all our questions. If anyone has anything else, feel free to type it in the chat or the Q&A, and we can try and answer it. And if anyone wants any of these links for Cal OSHA, I can provide those through an email if that's easier.
Corin, I had one other thought actually to the previous question about transmission. There was one recent study that I saw, which was in looking at children under 5 and risk of infection when the parents were vaccinated or not. And they did see a decrease in rates of infection. And so children under 5 are currently not eligible for vaccine. So it would be a group of individuals that would be unvaccinated. And it seemed that having parents that were vaccinated reduce the risk of the child under 5 from getting COVID compared to households where the parents were unvaccinated. So, so that is some kind of indirect data, I guess, for vaccine and transmission risk.
All right. Thank you. That's a a good example. So I'm not seeing any more questions in the Q&A. And so I'd just like to take this opportunity to thank our panelists for bringing your expertise and allowing everyone to ask questions on COVID-19 and any changes. And if anyone has any questions, feel free to reach out to me. I'll put my email in the chat and send me an email. I can try to connect you with anybody if you want to speak to them directly. So I think that's all we have for today. All right. Thank you very much.
Thank you.
Thank you, everybody.
Bye.